hand care. This is a very important part of being a manual therapist. I feel like this is the John Wooden moment where teaching an athlete to tie their shoes correctly is kind of the foundation of everything moving forward. Our hands are what we use all day long, so you got to take care of them. That's for your sake and how you use your hands, but then also for the patient experience. Long nails, rough calluses, all that stuff can take away from the intention of what you're trying to do because it's distracting and painful. You know, doing CrossFit and other activities is really cool, but your patients may not care about that when your hands are super rough and it's not comfortable with whatever manual work you are doing. So we have a couple of things here, very simple. Take care of those nails. We got our nail clippers and a little nail file. And we also have a callus shaver. So let's go through this. Basically, we have nails, right? This is something that is often neglected, but being able to trim our nails. So I like using, some people like to use like little nail scissors. I really like the clippers. And what I'll do is I'll just make some cuts kind of around there. Then you're left with this nice rough edge. So I'll take a nail file, and rather than going straight on, I like to angle it a little bit, and I'll just kind of buff out all those corners. And if I do this right, and it doesn't take very long, it only takes maybe a minute or two to do the entire hand or hands, you get this nice kind of beveled edge, and there are no sharp spots, and you can just kind of check by running your thumb along it. Again, if I'm going to use my thumb and kind of hold either somebody's neck or put my thumb into like a tender point or a trigger point, I really want to make sure that it's not that they're not going to get this like nail mark that's like left in them. There's no point in that. I want to use my thumb, not my thumbnail for most of this stuff, okay? So again, that's a nice way to do it. I would go around and do all 5. Of course, clean up after yourself because nobody likes that. All right, the next part is a callus shaver. So typically in the functional training world, we will get a lot of calluses along here. These can be rough. It can be on your fingers as well, so depending on what kind of techniques you're doing, how much like neck handling you're doing, whatever it might be. But again, that can be a lot of times be distracting. Plus, if these calluses overdevelop and you are doing some functional training, i.e. barbell work or hanging from bars and whatnot, if you tear because you don't take care of your calluses, it's going to put your hands back for doing the manual techniques that you want to do. So it's super important to make sure you're just taking care of those. So these callus shavers are super cheap. It's got a little razor blade that's in there. And so if we take this, I'm going to kind of target this guy right here. And all I got to do is take it and just slice across it like a cheese grater. Again, this is something that's also very gross, so make sure you clean up after yourself. Otherwise, like I said, it's just gross. Probably going to get yelled at and have to clean up everything. But if I can shave that down, that's really, really simple. It only takes a few seconds to kind of go through and cover each hand. And all you got to do is, even if you just did this like once a month or something like that would be fine. The nails are probably, it should be about a weekly frequency. You can also go, they do make some of these that have a little built-in file, so you can also do the same thing and go back and kind of file. This one does not have it. You can kind of file those down and just make sure that everything is as smooth as possible. Again, great for manual therapy, just general hand care, but also prevent those rips and tears when you are in the gym. So again, super important, make sure you take care of your hands. That'll have a much better response from your patients when you are using manual therapy techniques.